Your Excellency, first of all, permit me to remind all of us on the economic statistics released by the UNICEF in the year 2017. The statistic was conspicuously very clear that 4 out of every 10 Nigerians, 4 are living below a poverty line, which means 4 out of every 10 Nigerians are in abject poverty, a level that virtually everything that life needs is absence for them. And that gives birth to about 10.5 million out-of-school children in this country, with higher concentration in the north, unfortunately in the north. This has contributed to the multi-crisis we have in the north today. And from 2017 to date, about 13 children are out of school who cannot afford the basic education. This is why my boss and the Speaker of the 9th House of Representatives of the Federal Republic of Nigeria, Barrister Abdul Hakim Gbajabiamila, came up with this initiative to address that gaps that exist in Nigeria. Like the coordinator of the program had just said, this program started in the south, and gradually we launched this program in the north. We started with Gbajabiamila village in Abuja. We did in Daura. We did in Dawakin Tofa in Kano State. And by the special grace of God, Your Highness, today we are in your palace to formally enroll 500 less privileged kids that are on the street to be able to be registered in the conventional schools. This package includes provision of uniforms for the kids, instructional materials, and this network will continue to cater for these kids by the grace of God as much as we are alive up to university level by the grace of God.
As far back as September 2019, the body of aides to the Speaker formed a volunteer group as professionals working under the Speaker. We felt the Speaker has given us a platform to serve, and it will be unfair on us not to use the resources that we get in salaries and allowances to also give back to the underprivileged members of the society. So since November 2019, starting from Mr. Speaker's constituency in Surulere, Lagos, we have had human capital development outreach like the one we are having here in Zamfara today. We particularly chose education and healthcare interventions. And in recognition of our role as aides, we are helping the Speaker to achieve the legislative agenda is set out since October 2019 as the Speaker of the 9th House of Representatives. Across the country, we have reached out to about 100,000 households. What I mean by that is that in Surulere, for instance, we reached out to over 10,000 secondary school pupils on education and healthcare intervention. We went on to Karumajiji community in Abuja. We've been to Daura in Katsina State. We've been to Dawakin Tofa in Kano State. Today, we are in Gusau. As you all know, the Chief of Staff to the Speaker, Right Honorable Sanusi Gbajabiamila, hails from this senatorial district, and he has been a worthy leader and mentor as the Chief of Staff to the Speaker. So under his watch, we have been able to reach out to about 100,000 households across the 6 geopolitical zones in Nigeria in the last 3 years. It is painful that the rate of insecurity in the country is something worrisome for all of us. But we have seen from research all over the world that education is the only panacea, to violence, to banditry, to kidnapping, and all the rest of those social vices. And so, if you ask me, the answer to insecurity is education. And we must continue to help government. We must continue to support ourselves as professionals. I see myself, first of all, as a chartered accountant, as a certified fraud examiner, and being privileged to work under the Speaker. I shouldn't sit down there, even though I'm working at the back end to improve policies and legislation. I also have been coming out on the field to carry out direct interventions. Today, we have about 10 million out-of-school children. By the Professional Volunteer Network, we have enrolled close to 500 out-of-school children before we came here. Today, we are adding 500 out-of-school children in Zamfara. And our model is not just to enroll and go to sleep. We have a monitoring mechanism in place to ensure their daily attendance and their academic progress. Because we have, reached out to the stakeholders in the community to profile the orphans, the out-of-school children in the community, and then we are onboarding them into school and ensure that we monitor their progress as they get along. We are targeting indigents. Some people can afford qualitative medical health care. It's not for them. We are targeting those underprivileged members of the society. We have our medical team here, like we did in Dawakintofa in January. They are going to screen them for hepatitis B. They are going to screen them for diabetes, for hypertension. They are going to give them drugs, malaria screening, and all the rest of them. Today, human capital development on healthcare and education needs a lot of attention in Nigeria. And the truth is, government alone cannot solve it. So we must continue as members of the household, private sector and government to collaborate to ensure that we improve what we have as socioeconomic well-being of the mass of our people. Yes, to all the parents and guardians of our beneficiaries, we started by profiling them. We have contact phone numbers for guardians, for district heads. We want to appeal to them to please ensure that these children go to school on a daily basis. We will continue to monitor them. We are going to have monitors across the 11 wards in Guzau. We have profiled 2 other local governments that we are going to onboard in the next couple of weeks. And so, like I said, we have a monitoring mechanism in place to not just enroll, but ensure academic progress, daily attendance, and in the end, enrollment, retention, and completion.
Needy child. You see, the parents, most of the parents are poor. The children are destitute. They don't have place to go. So somebody to come and take care of them, to take care of their education, to take care of their food. It's a quite acknowledging. I really appreciate and I'm happy with the way the whole program is taking place. During my house speech, I said, let the monitors also be monitored, because the problem is the implementation. A very important program like this will be implemented, but the problem is how do they monitor it? Because sometimes you will see when they start 1, 2, 3 months, they forget about it. It's not good. It's a serious job. It's supposed to be taken as serious.